Hi, my name's Cindy Woodman, and today I'd like to share with you just a few little golden nuggets that I've learned through the years on how to help your patients be more successful with their flossing. We have all experienced patients that we get them in the chair and we ask them, are you flossing? And inevitably they enthusiastically respond with, yes, I floss daily. And internally you're thinking, okay, this is a major eye roll, and you're thinking, if I were to stare at their gums really hard right now, they'd probably bleed. So you bite your tongue and you smile and you say, well, I think that it might be really, really beneficial if you show me how you floss. And invariably, when I hand a patient a piece of floss, it seems like what they do is they wrap really vigorously and quickly around their forefinger, and they go to floss and they're sawing back and forth. So I usually will tell them, okay, just because your finger's turning purple in like 30 seconds, it doesn't mean that you're done flossing. And usually your finger will be turning purple. So I have found for myself that when I step back and I have someone evaluate how I'm doing something, if it's my golf swing or flossing technique or how I'm holding the instrument when I'm working on a patient, welding, that's my new passion, then I learn not only what I'm doing wrong with my technique, but then when I step back and I watch the instructor or another hygienist or whoever, the proper technique, then I can also incorporate that knowledge into how I'm doing something. So invariably, I find then that if I show them, okay, let's both do this together, and I'll take a piece of floss and I'll say, separate these two middle fingers. Wrap that floss around those two middle fingers, but leave a little space. And then that leaves the forefinger and the thumbs free to guide the floss. So it allows the freedom to use forefinger and thumb, or forefinger and thumb and forefinger and thumb to access a contact area, work that floss in between. You can use a sawing motion, but once you're there, by having the forefinger and the thumb free to manipulate that floss easier, you can get a better C shape around the tooth, and you can go up and down laterally along the tooth and get better plaque and food bacteria removal. Okay, so patients, if you will just take the time to observe their technique, I think that you will have a much more success in their recall visit, and they're going to feel a lot more success in what they're doing at home, and they're more likely to follow through. Another suggestion that I always make is to keep their floss handy right next to where they sit when they watch TV. All of us are tired when we go to bed, so we're lucky to get the brushing in. So if they do the flossing while they're watching TV, they're more likely to get it done. Another suggestion that I like to do is I like to suggest to them to use a woven floss. When I was in school, they had first come out with Teflon floss, coated floss, and we thought that was great because you could get it into those tight areas. But later on we found out, and just through trial and error and experience with what we were seeing with recalls, that patients tended to that Teflon floss just kind of glided over the plaque and bacteria, and it wasn't removing it as well. So I found that I really, really like and encourage patients to use the woven floss. Now, in today's world, we're fortunate to not only be able to have woven floss, but it's charcoal infused. And the added benefit is twofold. First of all, that charcoal activated floss is great at inhibiting bacterial growth. Charcoal has been scientifically proven to help inhibit bacterial growth. But aside from that, it lends itself to causing that floss to be black colored. And patients love being able to see what they're getting off the tooth surface. Just one other little bit of information. In the classroom, if you happen to be going into the classroom and doing some instruction, I have found that if you draw, like on the hardcore poster board, some gums and leave some space so that you can utilize the students in your demonstration. Have the students be the teeth, draw out the gums and have a couple handles on the inside, and then use this wonderful yarn that we sometimes use at for birthday gifts or Christmas gifts. And it's woven, it's yarnish, and it makes perfect floss to do a life-size visual demonstration. Once you've given the demonstration, ask another child to come up and demonstrate it for the class so that they understand how to floss their own teeth. So just a couple of little tidbits. I hope they're helpful, and have a great day. Thanks.